This show is brought to you by the Chiropractic Broadcast Network. Check us out on the web at chiropracticbroadcastnetwork.com. Hello, everybody. Welcome to this edition of Tuning Into Health. This is episode number, I believe, 171. Yes, we keep on rolling on. It is Monday, February 20th. And a beautiful day out there. I think we're going to get a little rain in here in Iowa. You should be getting snow, but oh well. Mother Nature had other plans. That's all right. I love the snow every once in a while. So I don't mind using my snowblower. Hey, we got a lot of news for you today. I think you'll enjoy it. Well, maybe not the first story. Rick Santorum's medical malpractice lawsuit involves a chiropractor. What? I like that guy, but I don't know. His wife had a little thing. Experts fear disease is impossible to treat. Uh-oh. CDC grand rounds, prescription drug overdoses in the United States is an epidemic. Yet we have a Yahoo up in Mayo Pain Center in Rochester, Minnesota that, is warning against chiropractic adjustments. Come on. This isn't the 80s. It isn't the dark ages. Daily diet soda tied to heart attack and stroke. Most people think that's a health food. Hey, how do you think you block sugar from your body? I'll give you 7 easy ways. And vitamin B and omega-3 supplementation for cancer. I don't know about this. More doctors fire vaccine refusers. I'll go off on that. You can't fire a doctor. Or sorry, a doctor can't fire you. Anyway, we'll be back right after this. Blah, blah, blah. Blah. I'm back. And I had a nice restful weekend. Hope it was the same for you. Well, as restful as you can get with 5 kids. Anyway. Yeah, well, I tell you what, with the boys, they got they saved up for a big Lego thing. And the dang thing is huge. And my boys are so into Legos. And they all went 3 into together and bought this huge Lego thing, and hey, that kept them occupied this weekend. And they got it done in one day. I mean, they built the whole dang thing. I was pretty impressed. Hey, we got doctors are firing vaccine refusers. This is in the Wall Street Journal. I think I brought this up last week, and I wrote a little quote on this on my how did I get to that one? On my Facebook page. I said, it's impossible for a doctor to fire a patient. And it's such a power grab to even think that a doctor has the power to fire a patient. Now, a doctor can quit on you, or a doctor can refuse to treat you, but they're the employee. The patient is the boss. If the doctor was paying the patient, it'd be the other way around. But a doctor can't fire you. And so get that out of your mind. And if they refuse or quit, refuse to take care of you, and there's another dime a dozen. They're right around the corner and all that type of stuff. If a doctor comes to the point of firing you, then there's a big problem of communication. It has more to do with your doctor than it really does of you. So, that was in the Wall Street Journal this week. They talk about vitamin D and omega-3 supplementation and cancer. New data Says from Eureka Alert. However, women in previous history of cardiovascular pathology seem to have a higher cancer risk after 5 years of supplementation. What? The research is published in detail in the Archives of Internal Medicine. Although some studies have suggested that supplementation with B vitamins has some benefits for protecting against cancer, and randomized clinical trials conducted internationally in most recent years remain equivocal. The results of the study influence supplementation and polyunsaturated fats have been mixed. Okay. That's my big bugaboo with supplementation. I'm not a big fan of or a proponent of supplementation, except if you have a deficient diet. And then you should go only for those types of supplements that are whole food supplements. So it's like you're eating food. You're not getting a manufactured synthetic vitamin supplements, and they have synthetic versions of vitamin D, B, and all that type of stuff. So when that negative stuff comes out about supplementation, well, you know what? They have an RDA, recommended daily allowance, for a reason. And if you want to see the effects of vitamin deficiency, well, just don't take your RDA over time and see what happens. And your body can only absorb so much. A non-pregnant female can only absorb about 30% of what she intakes. When she's pregnant, guess what? That intake comes up to about 50%. That's of nutrients and all that type of stuff, because you're growing another baby. You're growing another human being. So, anyway. Hey, block sugar from your body in 7 easy ways. Have a fatty snack 10 to 30 minutes before your meals. Basically, you remain full longer. With the outlet of your stomach is a muscular ring, the pyloric valve. It regulates the speed at which food leaves your stomach and enters your small intestines. This valve is all that stands between the ziti of your stomach and the storage and glucose of your bloodstream. But you can send your pyloric valve a message to slow down. And so that talks about you eating something fatty 10 to 15 minutes before you eat, 10 to 30 minutes before you eat. Number 2 is start your meal with a salad. The reason, it soaks up the starch and sugar. Number 3, have some vinegar. It slows the breakdown of starch into sugar. The high acetic acid content in the vinegar deactivates the amylase and the enzymes that turn into starch into sugar. Because it acts on the starch only, it has no effect on the absorption of the refined sugar. In other words, it will really help if you eat bread, not candy. Okay. Number 4, sugar blocker. Include protein with your meal. You won't secrete as much insulin. Here's the paradox. You want to blunt insulin spikes, but to do that, you need to start off secreting insulin sooner rather than later. It's like a fire department responding to a fire. The quicker the alarm goes off, the fewer firefighters will be needed to put out the blaze. Number 5, eat lightly cooked vegetables. The reason you digest them more slowly, both fruits and vegetables contain soluble fiber. As a rule, though, vegetables make better sugar blockers because they have more fiber and less sugar. But don't cook your vegetables too much. Boiling vegetables only until they're limp and soggy saturates the soluble fiber. Filling it with water can also absorb the sugar and starch that you want it to. Also, crisp vegetables are chunkier when they reach your stomach, and larger food particles take longer to digest until you feel full longer. Sugar blockers. Have a glass of wine with your dinner. Your liver won't produce as much glucose. Alcohol has a unique sugar-blocking properties. Your liver normally converts some of the fat and protein to your blood and glucose. Eat sweets for dessert only. All of the above. The reason, all of the above. If you eat sweets on an empty stomach, there's something to impede sugar from racing directly into your bloodstream. No fat, no soluble fiber, no protein, no vinegar. But if you confine sweets to the end of the meal, you will have a built-in protection. And, kind of cool. So that article will be posted at facebook.com/Rohlfsen. And because we're into the diet thing and all that type of stuff, diet soda may be tied to heart attack and stroke. You know, I know people out there that drink this stuff, that diet stuff, because they think it's healthy. They drink it kind of like as a health drink. As I sip on my coffee. Diet soda may benefit the waistline, but a new study suggests that people who drink it every day have a heightened risk of heart attack and stroke. The study, which followed almost 2,600 older adults for a decade, found that those who drank diet soda every day were 44% more likely than non-drinkers to suffer heart attack or stroke. The findings reported in the Journal of General Internal Medicine don't prove that sugar-free drinks are actually to blame. Well, then why bring it up, you dinkles? Oh, let's see. Oh, CDC grand rounds. Prescription drug overdoses are a U.S. epidemic. Comes out January 13th. This is another series of occasional MMWR reports, which means that your tax dollars paid for it. These reports are based on the grand rounds presentations of CDC high-profile issues in the general health and sciences, practice, safety, and policy. The information about the CDC, the same people who hire Bill Bibb, grand rounds is available online at cdc.gov. In 2007, approximately 27,000 intentional drug overdoses occurred in the United States. And one death every 19 minutes. Prescription drug abuse is the fastest growing drug problem in the United States. The increase in unintentional drug overdoses rates in recent years has been driven up by the increase of class prescription drugs called the opioids or the analgesics. So that will be online at facebook.com/Rohlfsen. By the way, they talk about, prescription drug use being a U.S. epidemic, which it is. It is. It is a serious epidemic happening in our society. We've got a Yahoo up at Mayo Clinic in Rochester, Minnesota, and he's part of the pain clinic up there. And I can't find, where is he now? Where is he? Ta-da. Oh, goodness. Yeah, there we go. He's claiming that chiropractic adjustments cause stroke. And I had a buddy of mine who lives up in Rochester saying, hey, you got any data? And I'm like, yeah, sure. Go to chiro.org. There's a number of studies, especially linked to stroke and the dangers of stroke. I'm not going to say there's no risk, but the risk of having a stroke from a chiropractic adjustment. And then you've also got to delineate what type of chiropractic it is, because there's some techniques out there that, there's no way that it would do that sort of thing. But the numbers are between 1 in a million and 1 in 10 million. So if you average together, it's 1 in 5 million chance that you can have a stroke while having a chiropractic adjustment. And that's not even proving that the chiropractic adjustment had anything to do with it. If you look at national statistics, your risk of walking down the street and having a stroke are 176,000 to 1. So if 1 in 5 million versus 176,000 to 1, you could look at that as we are preventing the damn things from happening. So there is a medical doctor up at Mayo Clinic that people need to, and his name is Dr. Gazelka. Dr. Gazelka up at Mayo Clinic Pain Treatment Centers. Pain treatment centers. If you notice, they've popped up because, regular medicine doesn't know what to do with these people in chronic pain. And even the people at the pain centers don't know what to do. They give them antidepressants. Don't worry about it. And it's kind of funny. Not funny, I should say. But what they do is they just categorize these people and tell them how to live with it and all this type of stuff. Well, pain is there for a reason. Pain means damage. And it's continual damage. And if you guys, you don't want to refer out to any other professionals, You just want the patient to continually get worse, in my opinion. So, hey, there's a Chico chiropractor announces success in treating high blood pressure. And all he's doing is going off a study done in a medical journal about, people with high blood pressure and how often they see success in lowering their blood pressure. Missoula Chiropractic, Neurology and Family Wellness in Chico. That's a mouthful. Doc, you might want to change that name a little bit. In California, announced that the practice has successfully helped treat high blood pressure in patients with chiropractic adjustments. A 2007 study published in the Journal of Human Hypertension found that chiropractic adjustments were more effective at lowering blood pressure than two different medications combined. Researchers suggest that the injury to the neck earlier in life may impede the flow to the blood. Chiropractic adjustments restore... I wouldn't agree with that. Chiropractic adjustments restore the alignment to the cervical spine and correct this problem. I would agree with that. Reducing blood pressure, chronic high blood pressure increases the risk of stroke, heart attack, and other health problems. So, Missoula. Dr. Larry Missoula. Well, good on him for getting that press release out there and telling people that you can help people that have high blood pressure. A lot of times when a person comes into my office and I see that they are on high blood pressure medications, I will give them a warning. And the warning is something like this. Listen, there are studies out there that show that once you get we start adjusting your neck, your blood pressure could go low. Now, if you have high blood pressure and if your blood pressure medication lowers it, there could be a chance that you could bottom out. So if you start feeling faint or lightheaded and all that type of stuff, you might want to go back to the medical doctor and see if you can get that blood pressure medication reduced. And evidently, that's what happens. They get a reduced until we've had some patients that completely go off the medications altogether, and that is awesome. I am for anybody getting off of all unnecessary medications altogether. That's a wonderful thing. All right. Hey, guess what? We got Genuinely Pure right after this.
Do you have itchy, dry skin? Struggling with acne, eczema, asthma, or other health problems? Or maybe you're just looking for a safer, natural alternative to cleaning and skincare products. Maybe it's finally time for you to make the switch. What do I mean? A vast majority of skincare and cleaning products today contain toxic synthetic ingredients that are having a devastating effect on our health and our skin. But there is a better way. At Genuinely Pure, it's our mission to provide 100% natural and safe products that you'll absolutely love, and provide them at affordable prices. We offer a full line of products for the body, face, home, and baby, all full of pure plant-based organic ingredients to nourish, heal, and rejuvenate your skin. So now are you ready to make the switch? Come check us out on the web at genuinelypure.com. Find us on Facebook or follow us on Twitter. Place an online order with the promo code Dr. Chad to save 10% off your purchase. Make the switch to Genuinely Pure today.
And you are tuning into Health with Dr. Chad.
Yeah, I tell you what, folks, the wife is on me because we ran out of Genuinely Pure soap. She's very partial to the cinnamon. And I tell you what, we ran out and I got to go order more. Incidentally, if I use that code word Dr. Chad in the promo place, I'll save 10%. So please, I'd encourage all of you to go to genuinelypure.com and pick up that those body care products, because you know what? They were voted best body care products in America. So that's from the Taste Awards. That's from the big guys, you know. So that's congratulations to Jenny Drew and her husband Isaac. Hey, we've got experts now fearing diseases impossible to treat. Like, this is something new, folks. So this comes, Britain is facing a massive rise in antibiotic-resistant blood poisoning caused by bacterium E. coli, bringing closer the spectrum of diseases that are impossible to treat. Experts say the growth of an antibiotic resistance now poses a great threat to the global health and emergency of the new diseases such as AIDS and pandemic flu. Professor Peter Hawkey, okay. The clinical microbiologist of the chair of the government's antibiotic resistance working group said that the antibiotic resistance had become medicine's equivalent to climate change. Well, no, this is real. Climate change is not man-made. So the whole problem with the antibiotic-resistant bacteria, that's man-made. Climate change is not. So don't even try. Don't even try. But it's a slow, insidious growth. The resistant organisms was threatening to turn common infections into treatable diseases, he said. Already in 2000, an estimated 25,000 people die a year in the European Union from antibiotic-resistant bacterial infections. So, hey, that's 106,000 here in the United States. They're better than us. But you know what? I'm going to say this. The chiropractic profession has been warning this since 1951, where it used medical journal articles to prove that there was antibiotic resistance. And they knew about this problem back in the 1950s. And why the hell is your medical doctor prescribing you antibiotics for a sinus infection or a lung irritation or a cough? And why are they prescribing it for strep B? Okay, because what ends up happening is that just makes that stronger and stronger and stronger. The more you use antibiotics means the less likely they are to work if you're ever in a crisis situation. God forbid you're ever in a crisis situation. My wife, when she was growing up, yeah, she would take antibiotics and all that type of stuff, just like any other kid. Had ear infections, and they'd have antibiotics. And, oh, she got strep throat, she'd have antibiotics. When she met me, we stopped all that. Yeah, we stopped all of her medications. In fact, she was told that she would have a condition that she would always have to take medications for the rest of her life. And guess what? Bam! Got rid of it. So, which stunned her endocrinologist. So, fast forward 15 years, or no, yeah, 14 or 15 years, and we have an episode where we're postpartum. We just had a baby, and kind of weak. And what she ends up happening, she catches a bug. I'm going to say it was probably the flu, which is, that happens. Once every 15, 20 years for me, I get the flu, and it's a week of not feeling well. And what ended up happening is because her body was so weak from giving birth 8 weeks prior, it took hold, and she ended up having pneumonia and whatnot. She went in the hospital, and it was touch and go. Basically, if those antibiotics didn't work, which they wouldn't have worked if she had had a lifetime of using those antibiotics, then we were going to be in a heap load of trouble, and I was going to be a single dad with 5 kids. So, yeah. So what ended up happening? She went in that emergency crisis situation. The antibiotics were applied as they appropriately were, and boom, that's a great thing for emergency and crisis medicine. That's a wonderful thing. So that I'm not against medications. I'm against the use of indiscriminate use of medications and what it can mean in the long run to people's health. Using medications, if you are on a medication and you feel good, it doesn't mean that you're healthy. It doesn't mean you're healthy. In fact, it actually secures the fact that you're not healthy and you're going to remain unhealthy. So if you can get off of all unnecessary medications, that would be a wonderful thing. That would be a wonderful thing. So, speaking of medications, hazardous medications, there's more than 1 in 4 elderly patients. Wow, talking a lot. Need coffee. Kind of cool. I have a cough button. More than 1 in 4 elderly patients was given a potentially hazardous medication during 2007. That is a conclusion of a study Goodness, I can't even pronounce this name. Giving certain medical drugs, substances to over 65-year-olds can increase the risk of desired drug effects. For this reason, experts describe them as potentially inappropriate medications, which are off-label prescribing and all that type of stuff. The study used information from a large database to attempt to estimate the risk of potentially inappropriate medications for older people. According to age, sex, and drug substance, the researchers used data from, 447,592 men and 356,808 women ages 65 and older to assess how the potentially inappropriate medications were prescribed to the patient. Women had more of these PIMs, they call them, than men. Potentially high hazardous drugs were often prescribed with amitriptyline, anacetildigitoxin, tetrapazolam, and oxapat. I'm glad I'm not a frickin' pharmacist because these frickin' names are just amazing. Overall, 8.8% of patients in the study received 4 or more prescriptions for the same equivalent drug in the period study. Okay, let's get to Rick Santorum. Oh, no, wait a second. I'm going to wait for Rick Santorum because 60 Minutes has a little video out that I think that you should look at. So here we go.
Time editor Ann Silvio talks with Leslie Stahl.
Leslie, you did a story this week about antidepressants. It turns out that there's a huge placebo effect going on for people taking these pills. This is big news for millions of people.
It was big news for me to think that these drugs that so many people take, in many cases taking a sugar pill, stunning as this seems, has the same effect. Who would have thought?
This is the placebo response.
You interviewed Irving Kirsch, the Harvard placebo expert, and they don't really understand how this works.
They don't. They don't. What our minds can do to affect our health that we have no idea about is just kind of breathtaking. So how powerful is the placebo?
It depends on a lot of things. For example, placebo capsules are more effective than placebo pills. Placebo injections are more effective than placebo capsules, and placebo surgery, that's much more powerful than any of them. We know that brand name placebos are more effective than generic placebos. Higher priced placebos are more effective than lower priced placebos. If you want a placebo that's going to make someone sedated, calm, relaxed, blue placebos work best. If you want to stimulate them, block pain, red or white placebos are better.
Can you believe that? Red pills are more effective than blue pills? What?
All of this has been studied.
What is wrong with us?
Absolutely nothing's wrong with us.
So 17 million Americans take antidepressants. For the majority of people taking antidepressants, 60 Minutes does a story that says it looks like it's really the placebo effect at work here. Now, I wonder, were you concerned that the next morning half of America wouldn't be able to get out of bed?
I was concerned that half of America would think they could just go off the antidepressants, which would be a disaster. I was very concerned about this, and so was Irving Kirsch.
First of all, they should not stop seeing their psychiatrist. They should not throw out their pills because you can't just stop taking an antidepressant.
My husband has been on antidepressants for years, and we know they work. That's why this story was so stunning for me. To find out that it could be the placebo effect rather than the drug. I mean, it really did shock me.
Because you've watched someone up close.
I've watched it. I've seen them work. But then Irving Kirsch says, well, they do work. The placebo is working. I walked away very confused. Now, they do say that the drugs are effective for people with severe depression. The placebo effect is stronger for people with mild depression.
By telling people that it's a placebo effect, does that kill the effectiveness of their medication?
There are studies that show that even when you tell someone that they're taking a placebo, they still get the placebo effect.
But you have to explain to them why it should work. If you just came in and said, well, here's a placebo, that won't work.
Right.
But if you say, look, you have a condition that we know is responsive to placebos. That means you have within you, within your mind, the ability to affect this condition. And what we're going to give you these placebo pills for is to help you to unleash that natural ability that you have.
And bing, it works.
And it works.
For me, I guess I'm hoping that even if people hear that the antidepressant they're taking is no better than a sugar pill, they'll still get the effect from it.
And for your husband?
He knows it works for him, and maybe that's the way people are going to see this. They're going to say, but I know they work for me because I feel better when I take them.
Okay, folks, that's what we see in our society a lot of times. And for a placebo, all you got to really realize is that the brain does have the ability to, promote healing in the body. And so that's all a placebo is. It's a plague for pharmaceutical industry because they basically they have a lot of trouble with the placebo. It's 33% effective. So for a drug to prove better than the placebo, it has to be, 34% effective. That means it could be, 60-some% wrong. So anyway, hey, we got Rick Santorum's wife ended up suing her chiropractor for $500,000. And so he's getting a lot of criticism for this because he's talking about, limits on malpractice spending. So he's blaming it on his wife. And she's saying that the chiropractor caused a herniated disc. And I'm going to stop right there because there's no way a chiropractor can cause a herniated disc. Chiropractor can exacerbate it if they don't know how to apply treatment to it. I can tell you that much, but there's no way in Sam Hell that a chiropractor can cause a herniated disc. And you know what? What really would have made the whole case is if they could prove that she didn't have a herniated disc before she went into the chiropractor. So I'm a specialist. Specialties are migraine headaches for me. I like dealing with these problems. I like dealing with herniated discs. If we could get an MRI, that's the only way to diagnose a herniated disc. If we could get that before, that'd be fine. But it's kind of like throwing a nuclear bomb in an anthill. If we can apply care to that herniated disc or that lumbar spine, and we don't touch the lumbar spine, that's the secret, but we stabilize around it, what ends up happening is that herniated disc will disappear. So, and that happens more often than not. If it's such a bad problem, it's gone too far that it's something that I can't take care of, I've got a neurosurgeon that's a real jerk that I like to refer to. Other than that, folks, I believe it or not, I went out and adjusted during that little video segment. So I've got people waiting, and I want you to have a great day, and we'll talk to you later, folks. Bye-bye.